Paul Moulton.
Thank you, Chief Minister. Back to Kathryn on that, just a part that Lewis was mentioning there, and you were talking about how many vaccines you got. You said you got enough for this week, so naturally there's a big run on the bank for everyone wanting to get the boosters. How are the supplies holding up?
Yeah, absolutely fine. We actually got enough thawed for this week. In fact, we're in the process of defrosting some more because of the demand that we've seen in the last couple of days. And again, we've got more than enough for into next week. And then we're drawing down as we can, as we've always been doing from the UK in order to supply beyond the end of January. So no issues and cause for concerns around vaccine supply at all.
And secondly on that, some days it's Pfizer, some days Moderna. I mean, what's going on there? Why the mix and match going on?
It's again down to the supply. We receive about 22% of the supply is Moderna. So all comes from the UK. At the moment, we're doing a number of Moderna days that will then move on to Pfizer towards into next week, and then we'll flip back. So it really depends. It depends on the supply that we've got. It depends on the vaccinators that we've got as well. So ultimately, we've managed to clinics about a week in advance, but it's all down to the supply that we receive from the UK, and it is a blend of those two vaccines. But if anybody else, for clinical reasons, needs to have AstraZeneca, then that is also available.
And Chief Minister, you mentioned circuit breaker there. I mean, obviously, this is the big word everyone's listening out for. What trips it? I mean, is it the run on the NHS? And will that involve more than just lockdowns? Will that involve travel restrictions / shutting borders of any description?
Paul, I merely highlight the fact that, as a nation, as we move forward, and today really is about announcing us moving forward together rather than the government determining how we should move forward by imposing restrictions, that moving forward together is in everybody's best interest, not just for managing the Omicron variant, I think, but also moving forward as we learn how to deal with and manage COVID, particularly if it's going to be here for a long time. And of course, I know everybody likes to talk about restrictions and lockdowns. We've made it clear that is our last resort. But I also want to make it clear that we will not hesitate if we do believe that the nation's security is coming under threat in any way, or that people are being exposed to a level of risk that is unacceptable. And there are lots of factors that we have to consider. But yes, very much at the heartbeat of it will be the ability of our health services and health professionals to deliver the required level, I would suggest, of protection in terms of the ability to look after people on this island in a proper manner.
And would that involve borders if necessary?
Paul, again, I think the borders question, I hope, has left us now, but nothing can be ruled out in these circumstances.
Thank you very much, and Merry Christmas.